quarantine yourself. And but if you don't feel good after a while and you're not getting any better after a day or two, then you should be, you should go to a hospital or somebody should check you. Even that, they're not talking about telehealth. Well, you can talk to your doctor or some healthcare provider, and they can give you instruction what to do, what to expect, and what to look for that's different from the flu. So they're starting to learn more about the disease. They're starting to learn more about a little bit of difference between a regular flu and the coronavirus, COVID-19.
Right. To answer questions from our viewers, yes, you mentioned about, we'll ask you the difference between a flu and the coronavirus. But first, when you test positive, an individual tests positive, it doesn't mean that it's fatal, correct? If the immune system is good, one can recover.
Of course, there's an 80% recovery rate. They already know that, 70 to 80% recovery rate. So right now, there's such thing as a peak. Like, when does it peak? When does a country like Italy, for example, peak from the disease? That's what they're looking for, because right now, Italy, there's still a lot of people dying every day, like as much as 340. They reported 360 dying the other day, and yesterday they said 340. So far 2,000 people died in Italy. So they haven't peaked yet. You have to, when the death start to drop down, like if you hear Italy's death rate is down to 150 to 100 to 50 to nothing, then you know that that seems to be slowed down or peaked. South Korea, for example, had peaked. So every country is different.
I see.
So they have to have statistics and numbers, and people have to be careful. And then when you peak, and when the people are getting disease slows down, or the people dying slows down, then you know you peaked. Okay. Then they might loosen up the rules about how when you go out and when they can open up restaurants again and things like that. That's how you figure out.
Is it correct to assume that people have been saying, you know how it is with people, they listen to the news, they hear something else. They say that with the warmer weathers, it will be much better. Is that correct?
Well, that's not true anymore, because why would they have that in the Philippines? You see? So you can't rely on that.
Right.
It used to be that in the United States, on the eastern part, where it's cold, it gets cold in the winter, and then it gets warm in the spring and summer. In the flu season, the flu gets better when it gets warmer. This is the regular flu. And but we don't know about this COVID-19. We have no idea, because it's new. That's why they call it novel, NOVEL, because they don't know. Nobody knows what it does.
We're talking to the chairman of the World Surgical Foundation, Dr. Domingo Alviar. Of course, as we finalize our interview with him, he'll be giving you a summary of the projects they had done and will be doing in the future. And at the same time, we're getting clarification with regards to, the doubts and the queries from our viewers and listeners. You mentioned earlier the difference, like somehow there's a difference between the flu and the coronavirus. What are the main differences, Dr. Alviar?
I think the main difference will be the lungs. That's why people who get very sick, they're put in ventilators. If you remember what's happening now in New York, Governor Cuomo is asking for ICU beds and ventilators. You see, he said if the population gets sick and they go into that respiratory problem, then they don't have enough ICU beds and they don't have enough ventilators. You see, that's a problem. And they saw that in Italy right now. They're having lack of beds to take care of sick people and lack of ventilators. So that you have to prepare, and this is why today President Trump have another executive order to allow manufacturers to manufacture more of these things. To hurry up the ventilators, and the military is also asked to make sure that we have enough ventilators if things go really bad.